Namaste, my name is Dr. Jankna Butch. I am serving as a Chief Medical Officer at Apollo Ayurveda Hospitals. While the peak monsoon season is on and everybody is enjoying the cool showers, but there is also an underlying concern, and as the time is going by, we are hearing a rise in cases of dengue, and especially in the state of Karnataka, the number has reached very high. Why and what is it that is making dengue so common in this season? Let's try to understand that according to Ayurveda, monsoon season or Varsha Ritu falls in the month of Ashad and Shravan. These 2 months and the next 2 months are where there is peak aggravation of Vata dosha and profound accumulation of Pitta dosha. During this time, because of the environmental impact that is there is also a change in our own Agni, and there is a tendency to have a build-up of Ama. This makes the entire external environment and an internal environment very favorable for febrile conditions. And something like dengue, which is caused by a mosquito bite, Aedes aegypti, a viral illness, is also very favorable. The environment is very favorable for it to flourish. And because of this, various common presentation of dengue virus, what we see is outspread of fever, rash, body ache, and so on. 98% of patients who suffer with a thing of fever and rash can also recover by themselves very easily, because it is a self-limiting biology of this kind of a viral pathogenesis that is going on in the body, that body tries to go against it and make up for it. In the event, there is decrease in your platelet counts, but body has a tendency to make up for it, and within a period of about 2 to 4 days of active incubation and followed by that fever, rash, and a fall in platelet, after a certain period of time body is able to cope up. 1 to 2% of patients are such who cannot recover easily. These people, from an Ayurveda perspective, are highly prone to Pitta, and these are the people who can get into complications of dengue, which can lead to uncontrolled bleeding, dengue hemorrhagic fever. There is further rise of platelet counts, further fall in platelet counts, and which leads to complications. Now, leave apart this 2% of patients. Other 98% of patients can be managed very well if the symptoms are monitored well, and if there is a good doctor around you to take care of you and guide you. So while we are talking of patients who are with active dengue fever, what can we do to prevent dengue fever in this season? So first thing, as we spoke, we are talking of two key things here: external environment and internal environment. Let us try to ensure that the external environment is damp free. It is hygiene is of highest standards. There are no water puddles to ensure that there are less mosquitoes. Proper mosquito repellents are used. When you go out, your exposed areas you are able to cover well. When you already know that you are going into a mosquito infested area, you should use appropriate mosquito repellents. And also at your own home, try to do classical Ayurveda dhupams, which will ensure that hygiene is maintained, antimicrobial environment is sustained. Now, taking care of internal environment. As Varsha Ritu begins with high Pitta, it is important for you to understand that you need to maintain your Agni. You cannot allow it to fluctuate or to go down. In either of the state of Vishamagni and Mandagni, you are likely to fall sick because your own innate immunity will come down and you will become susceptible to fever-like illnesses, including dengue. So, to do this, you need to ensure that you have a very light diet, adequate hydration, pay attention to your baseline appetite, ensure that the motions are well evacuated, and you are able to have a good and a restful sleep. Amidst all this, when you are working extremely hard in unpredictable routine, ensure that there are consistent timings of your meal, sleep, which are maintained. Whenever there is a fall or whenever you are overworking, try to ensure that you have adequate rest after that, so body is able to recover. These very basics, if you take care of external care as well as internal care, I am very sure that you will be able to prevent fevers including dengue. Well, while it is more of an external vector which comes and bites and then it causes, even if you are manifested with that, you will fall under the first 98% who will be able to have a self-limiting biology and will recover very well.